Good afternoon, everyone. All right, I like the smiling faces. And also everyone quieting at the same time. Very nice. Some of you have already met me. My name is Dr. Shereen Burrows, and I am the Executive Director of External Partnerships here at Dornsife School of Public Health. I'm so happy to have you all with us this afternoon for our annual pinning ceremony, one of our greatest honors here at Dornsife. I was just here to get the party started. I'm going to introduce you to our real host for this afternoon, and that is Dr. Melissa Kaufman, our Associate Dean of the Office of Education. Melissa, take it away.
Thank you.
Hello, everyone. Tareem, thank you so much for getting us all jazzed up and excited to start the afternoon. So on behalf of the Dornsife School of Public Health, I would like to welcome you to today's pinning ceremony. This ceremony is a long-standing tradition since the school's founding in 1996. And it's our opportunity to welcome new students, staff, and faculty to the Dornsife School of Public Health at the start of each academic year. Today's program includes a tradition that was first instituted by the school 29 years ago by our first dean, Dr. Jonathan Mann. Dr. Mann was a humanitarian advocate and visionary who highlighted the intersection of health and human rights. Incoming new public health students received the School of Public Health pin as a reflection of our commitment to social justice and our mission to advance health as a human right. And it's an important step that formally welcomes you into the field of public health. This year, we are welcoming over 135 new public health students, both in person and online. Students in our online program who are not present today will receive a pin in the mail in the next few weeks. Today, we welcome you to the Dornsife community, whether in person or virtually. Following the presentation of the pins, our student government organization leaders will lead everyone in the pledge, reciting the preamble of the Universal Declaration of Human Rights, adopted in 1948 by the General Assembly of the United Nations. At this time, it is my pleasure to introduce you to the Dean for the Dornsife School of Public Health, Dr. Gina Lovasi, for opening remarks.
Thank you so much, Melissa. Hello and good afternoon. I'm delighted to welcome everyone to the 2025 Welcome and Pinning Ceremony for the Dornsife School of Public Health. This is a ceremony we do every year to welcome all those who are new to our school as students, staff, faculty, and most importantly, even those of us who are continuing, take this moment to recommit to our doing our part to make health as a human right a reality. This ceremony highlights our school's historical commitment to social justice as a key to achieving health equity and health for all. Public health crises in our city, our country, and around the world demand our attention and action. As scholars, we have a responsibility to inform those seeking to make evidence-based changes that benefit populations we serve across the globe. In our work with communities, policymakers, and with the media, we have a responsibility to elevate the visibility of the forces that undermine health. Looking beyond the present crises, whether violent acts or climate-related natural disasters, to understand the upstream vulnerabilities in our social and physical climate. And we have a responsibility through our courses and degree programs to show and grow the capacities of an agile and resilient workforce so that future public health professionals and their interdisciplinary colleagues have the skills and commitments needed to avoid and counteract threats to health in every setting, including meeting the challenges of impoverished settings within the US and globally that lack the infrastructure for healthy lives that we take for granted. We're here with these responsibilities in mind and determined to recommit to a shared purpose as we pursue our research, practice, community engagement, and educational activities. We're well prepared to do this important work, and we can take inspiration from all those who are around us and with us today, virtually or in the room. However, preparation and inspiration aren't enough. There's something else that we need that I really value about our school, and that is that we continue to quest for more. At our school, we're not satisfied with the status quo. We will not be content to do what we've been doing when the world around us has changed. We will not accept conditions or treatment that falls short of respecting human rights and dignity, and we will not be complacent about the state of science, but we will instead roll up our sleeves and develop better tools and move our work forward in ways that can advance the frontiers of knowledge. To remind us to carry forward into our daily lives the commitments that we make here today, we honor a school tradition. Our founding dean, Jonathan Mann, created the pin that we'll distribute today and that we have distributed annually for nearly 30 years. Dr. Mann had a vision of a school that is committed to health as a human right, imbued with a humanistic vision for centering public health around people. This commitment is enduring, refreshed in new ways throughout our school's history, and more relevant than ever today, both here in the United States and all over the world. My main purpose here today is to welcome all the new students, staff, and faculty from all backgrounds, those with us from our local area, from areas throughout the US, and from countries around the world. Additionally, I'd like to take a moment to acknowledge that our school has recommitted to our external impact through a couple of new leadership roles. We have named this year an Associate Dean for Human Rights and Global Health, Dr. Alex Eze, and a new Associate Dean for Public Health Practice and External Relations, Dr. Ana Martinez Donate. During one of the most challenging times ever faced by the field of public health, Drs. Eze and Martinez Donate have agreed to step into these leadership positions using their decades of experience, research, teaching, practice, and service to strengthen our mission and guide our work. I want to provide also today an extra special welcome to the faculty and staff who are joining us today from the A.J. Drexel Autism Institute. We're looking forward to continuing to work closely together. We have had partnerships with this amazing institute, and we're formally moving them to become part of the Dornsife School of Public Health, and that deserves a moment to really mark the transition. Since the launch in 2012, the Autism Institute has taken a prominent place in the field as the first research organization to apply a public health approach in the field, a public health approach to understanding and addressing the challenges of autism spectrum disorders. With subsequent growth, the A.J. Drexel Autism Institute has continued innovating and distinguishing itself as one of the nation's leading academic authorities on public health issues in autism spectrum disorder. The Autism Institute's central mission of improving the quality of life for individuals with autism of all ages through community-based action aligns and brings new dimensions to the Dornsife School's commitment to health as a human right. And I think that is exactly what we want to use this moment for each year, is to find ways to make fresh and real what could become a stale historic commitment. To all new members of our school community joining us today, welcome. You are key to our future as a school. Before the pins are distributed, I'm delighted that we have an opportunity to hear a few words from a speaker who exemplifies the commitment to health as a human right, and who will help us be inspired to fulfill our responsibilities for overcoming threats to health. It's my pleasure today to introduce Marianne W. Wentworth, a longstanding leader within our school's External Advisory Council, who will be delivering a few words. Marianne is the President and Chief Executive Officer of Management Sciences for Health, in addition to serving as a member of our Dean's Impact Advancement and Learning Council. As a leader in managing complex international public health initiatives across diverse cultures, Marianne uses her private sector and nonprofit acumen to address global health challenges from new vantage points. Before coming to Management Sciences for Health, Marianne managed global strategy for marketing, manufacturing, and research at Merck & Co. for more than 25 years. A champion for adolescent health, She led global sales and marketing launch for the world's first cervical cancer vaccine, Gardasil, and she has also managed adult vaccines for shingles, influenza, pneumococcal disease, hepatitis B, hepatitis A, and tetanus. I think this is a very timely moment to celebrate those who have continued to protect health and access to vaccines, and I hope you will join me in welcoming Marion to the podium.
Thank you, Gina, and thank you for that warm welcome. I'll have to try and live up to the introduction. As Gina mentioned, I am Marion Wentworth. I am President and CEO of Management Sciences for Health. Often we call ourselves MSH, so you might hear that a little bit in the next couple of minutes. MSH is a global health nonprofit dedicated to transforming evidence into action. For more than 54 years, we have partnered with ministries, frontline health leaders, communities in over 150 countries, many of them amongst the lowest income and the highest burden of death. Like Drexel, MSH believes that health is a human right. Our goal is not to replace or build parallel systems, but to strengthen what already exists. We work shoulder to shoulder with governments, civil society, the private sector, and community organizations, because the best ideas come from those who live with the solutions and who carry the trust of their communities. Only through that kind of deep collaboration can we build change that lasts. I'd like to give you a couple examples. In recent years, we've worked with the government of Ukraine, with private sector organizations there, and with civil society organizations to strengthen supply chains and implement evidence-based, technology-backed procurement and distribution systems. The result has been outstanding. Lower costs and increased access to ever-expanding lists of essential medicines for millions of Ukrainians, including treatments for tuberculosis, HIV, diabetes, and hypertension. Those same systems, first built to fight HIV, now underpin the country's emergency humanitarian response. This means that even amid war, more Ukrainians today can access life-saving medicines than ever before, and at lower costs. In Madagascar, we helped to build a network of community health workers. We established skill labs to close knowledge gaps for midwives and trained local clinic managers in leadership and communications. We also worked on strategies to bridge modern medical practices with traditional approaches. It's another recurring theme in how we partner with communities. These examples reflect a larger truth. Strong health systems are the foundation not only of healthier societies, but of thriving economies. When systems work, children are able to learn, families are able to work, and communities are able to prosper. When systems fail, entire nations struggle to advance. Delivering health takes more than just a doctor in front of a patient. To save lives, the right person must be present, trained, trusted, and supported. Additionally, the laboratories and medicines must be available, affordable, and reliable. And patients need some sort of financial protection. At MSH, we sum this up as the 4 Ds: doctors, drugs, dollars, and data. To be able to save lives, supply chains must function, laboratory systems must work, health providers must have training and a source of income, and patients need some type of insurance. These elements of the healthcare system need to work in synchrony with patient and community-facing workers that deliver care and other health interventions. If one piece fails, lives are at risk. And this is why we need public health, and why we need all of you. Now more than ever, we need rigorous research to understand what works and what the next changes to the system will mean. We need skilled providers to walk with patients and families on their journey towards a healthier life. And we need people who will believe, as we do, that health is a human right and work with all their being to make that vision real. Yet, as you know, today, the very foundations of public health are under strain from anti-science movements, reduced funding, and weakened global institutions. Here in the United States, we are less prepared for the next pandemic than we were in 2019. Surveillance systems have been dismantled. Researchers and academic institutions are losing funding or facing criticism or worse, harassment. These realities make your work and your commitment more essential than ever. I'm often asked, why do I do this work? My answer goes back to an experience that I had in Rwanda a number of years ago at a conference. In a breakout group, I found myself with health workers from Syria, Somalia, and Sudan. They spoke about what happens when war begins, when the bombs fall, governments collapse, and supply chains disappear. They described finding informal markets to secure supplies, sharing disease information through unusual communications techniques, and doing whatever it took to keep services going. Every hour that the fighting paused, they were looking for a way to make their health system better and stronger. And that spirit of resilience inspires me to this day. We must carry the same determination. The rhetoric may be loud, but we know that the work that we do matters, whether we directly interact with patients or make the system work from behind the scenes. Health is a human right, and it is also the foundation of opportunity, stability, and prosperity. Strong systems save lives, and they are what allows societies and economies to thrive. It takes all of us to realize this vision. To those of you who've already committed your careers to this work, and those who support and love them, thank you. And to Drexel's newest students, congratulations. Your journey you will never regret, no matter where it takes you. God bless you all.
Well, thank you, Marion, for those insightful, and powerful, and encouraging remarks. Your leadership serving as the president and CEO of Management Sciences for Health and continued service to our school is an inspiration for us all as we begin the new academic year. At this time, we would like to present the Dornsife School of Public Health Human Rights Pins to our incoming students. I would like to invite our department chairs and the director of the Autism Institute to the stage to present the pins. The School of Public Health pin was initially designed by our first dean, Dr. Jonathan Mann. The pin has experienced several changes over the past decade, starting when the school joined Drexel University, and the most recent modification took place when we became the Dornsife School of Public Health. Today's ceremony signals your introduction into a human rights-focused public health program. I hope you leave here today feeling inspired and excited about your chosen field of study. Students will now receive their human rights pins. Will the students in the first row please stand, and orientation leaders, can you help escort them to the stage? Okay, and now at this time, I'd like to invite new faculty or professional staff, including those from the A.J. Drexel Autism Institute, to the stage to receive a pin. So, sorry, I'll do it again. New faculty, staff to the stage, including those from the A.J. Drexel Autism Institute. We'd like to invite you up to get your pins. Woo! All right, congratulations and welcome. We're so excited to have all of you here. Now, Dornsife's student government organizational leaders, Shelley Verma, Chizoba Okoria, and Caroline Kravitz, will now lead everyone in reciting the preamble to the Universal Declaration of Human Rights, adopted in 1948 by the General Assembly of the United Nations. And this pledge signifies our commitment to health as a human right.
Today, we cross a threshold in our lives. For today, in this ceremony, we publicly enter the field of public health. We are embarking on an educational process which will help us find the professional pathway through which we can each contribute to public health and to the health and well-being of each individual within the global community.
The goal of public health is to assure to all the conditions in which people can be healthy. A commitment to this goal is made with full awareness of the difficulty and complexity of the challenge which lies before us. For we in public health know that society is the major determinant of health status because human well-being, physical, mental, and social, depend so much on the societal factors. We must work toward societal transformation. This commitment to social justice is guided by our respect for human rights and dignity.
We are strengthened by solidarity with those who suffer, with those who seek in many different ways to prevent and alleviate suffering with each other. Together, let us stand and quote the preamble of the Universal Declaration of Human Rights. Everyone please stand and recite the pledge together with us. 1, 2, 3.
Whereas recognition of the inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world. Whereas disregard and contempt for human rights have resulted in barbarous acts which have outraged the conscience of mankind, and the advent of the world in which human beings shall enjoy freedom of speech and belief and freedom from fear and want has been proclaimed as the highest aspiration of the common people. Whereas it is essential, if man is not to be compelled to have recourse as a last resort to rebellion against tyranny and oppression, that human rights should be protected by the rule of law. Whereas the peoples of the United Nations have in the Charter reaffirmed their faith in fundamental human rights, in the dignity and worth of the human person, and in the equal rights of men and women, and have determined to promote social progress and better standards of life in larger freedom. Whereas member states have pledged themselves to achieve, in cooperation with the United Nations, the promotion of universal respect for the observance of human rights and fundamental freedoms. Whereas a common understanding of these rights and freedoms is of the greatest importance for the full realization of this pledge.
And from the Constitution of the World Health Organization, we all join.
The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition.
This forms the basis of our concern with health, human rights and dignity, and therefore to public health. Today we mark and we celebrate this next stage in our commitment. Thank you.
You all can sit down again. Well, thank you so much to our student government organization representatives and to our new students, faculty, and staff. I just want to say again, welcome to the Dornsife School of Public Health and to the new academic year. My colleagues and I are so excited that you're finally here. And at Dornsife, we're fully committed to ensuring that you have the best possible experience, whether it be virtually or in person. And I hope you make the most of all that is available to you. As we celebrate the significance of our commitment, we are reminded that the ceremony connects you with over 2,600 alumni and many passionate public health advocates who were here before you. And I hope that you'll connect with us on our LinkedIn page. Here at Dornsife, there are dedicated faculty and professional staff who are committed to your success. If I could offer you one piece of advice, it would be to think of your future in public health, not in terms of after you get your degree, but how it relates to your present today. Today marks the beginning of your journey, so don't wait. Be an advocate, get involved in practicing public health today. As we conclude our pinning ceremony, we are thrilled to have such a wonderful new group of students and public health leaders joining us, and I hope you leave here feeling inspired. Thank you, and I hope you enjoy the rest of your evening, and please join us for the reception just outside the room. Thank you so much.